Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, an alarming increase in childhood obesity and hypertension, and another successful year for mini med school for kids. But first, the FDA approves the Pfizer COVID vaccine based on results of clinical trials conducted at the School of Medicine. Graduate student David Ruck was the first person in the United States to be vaccinated as part of the Pfizer trial at the School of Medicine's Center for Vaccine Development.
At that time, we had all been sent home. Right across the street, the hospital was overwhelmed with cases. The doctors were exhausted. The PPE was 3 days from being out. And when the first was announced that the trial was happening, I knew at that point, the only way we could get life going back toward normal would to be get a safe and effective vaccine.
The FDA analyzed data from 20,000 vaccine and 20,000 placebo recipients over the age of 16. The Pfizer vaccine proved to be 91% effective in preventing COVID-19 disease. With the Delta variant still driving up hospitalizations, David Ruck hopes the FDA action will convince hesitant people to get vaccinated.
The vaccine is very safe, it's very effective, it's saving lives. And at the end of the day, no one needs to die from COVID. We have a vaccine that prevents death, that prevents the serious hospitalizations. And it doesn't matter if you're here in Baltimore, in Wyoming, or in Ghana, everybody needs to have access to the vaccine, and everybody needs the opportunity to get the vaccine.
If you've already been vaccinated, you may be wondering how long it will be effective and when a booster shot will be available.
There's mounting data that's coming out of the US and internationally that the antibodies that were developed to the original vaccination are starting to wane, and the inflection point looks to be about 8 months. That's as early as we have right now, given that people began to have vaccinations in December.
The Center for Vaccine Development is now conducting the mix and match study to determine the effectiveness of booster vaccines in various combinations.
And we're studying them in every which way. In other words, for a group of Johnson & Johnson volunteers, a third will get Johnson & Johnson as a second dose, and then a third will get either Pfizer or another third getting the Moderna. And we're looking at that across the board at various intervals and using the same laboratories so that we're going to have a really good measure both for safety and also for immunogenicity at defined intervals for all the possible combinations.
Dr. Like expects the study data to be reported in the early fall so that boosters can be made available as soon as possible. In our Discovery segment, a School of Medicine physician says children are experiencing health consequences from living in the age of COVID-19. Dr. Bakri El-Zarkab has observed a dramatic increase in childhood obesity and hypertension.
We have recently noticed more children coming to our clinic, referred to a specialist to manage their hypertension. And we also looked at that data and we compared like pre-pandemic to post-pandemic numbers, and we saw more children with obesity and high blood pressure at the same time. And it is a significant increase. I mean, we saw almost 30 to 40% increase to pre-pandemic levels.
Dr. El-Zarkab says there are many contributing factors, but stress and inactivity appear to be the main culprits.
Also, when you're sitting at home, again with the pandemic especially, there is more stress. You lose that structure or schedule for kids, which is very important. So all of those factors definitely contributed to the obesity increase we're seeing recently.
In addition, Dr. El-Zarkab says access to medical care was restricted during the pandemic, along with access to more nutritious meals provided by the school systems.
You all have done a great job this summer.
Finally, it's a wrap for the 2021 edition of Mini Med School for Kids. During the 5-week program, faculty members gave interactive and fun presentations about science, medicine, and healthcare to students at the Franklin Square Boys and Girls Club in West Baltimore. Students were encouraged to consider careers in science and medicine.
We're going to talk about one of my favorite things, which is why I became a doctor, why we all became doctors, and how you all can become doctors too.
Remember, you must first imagine before any dream of any sort can become a reality.
And that's Frontline News. I'm Larry Roberts. I hope you'll join us again in 2 weeks.
When I decided I wanted to be a doctor.